Hi all, welcome to my video. Today we are going to study about the topic OPG, which is a very frequently asked topic in oral medicine and radiology. So first of all, considering about the definition of OPG, it is a technique of producing single tomographic image of maxillary and mandibular dental arches and their supporting structures. So let me show you some of the images of OPG. Okay. So the father of OPG is Dr. H. Vimatra and Veli Petero, and the OPG is used as a screening test for many of the oral and maxillofacial diseases. And the other names of OPG are panoramic imaging and pantomography. So moving on to the indications of OPG. OPG can be used for identifying the pathologies of tooth, pathologies of alveolar bone, pathologies of surrounding bone, pathologies of TMJ, pathologies of maxillary sinus, pathologies of styloid process. So moving to each one by one. So among the pathologies of tooth, we can find about the developmental anomalies, assessment of impaction, implants, age assessment, trauma, etc. And in the pathology of alveolar bone, we could assess the generalized periodontitis, bone craters and furcation, which you will study detailed in perio. And moving on to the pathologies of surrounding bone, we could identify about OPG is helpful in evaluating the maxilla, mandible, zygomatic fractures, cysts, tumors, etc. Cysts like OKC, dentigerous cyst, radicular cyst, etc. So in the pathologies of TMJ, which helps us to evaluate about the ankylosis, hyperplasia, fractures of TMJ, etc. In the pathologies of maxillary sinus, we could evaluate about the fractures, maxillary sinusitis, etc. And in styloid process, assessment of the styloid process elongation can be done. So moving on to the principles of OPG. OPG works on the basis of principle of tomography, and there are two movements. One is the opposite movement of the film holder and the X-ray, and the second one is the own axis movement of the film holder. So in this diagram will give you a more idea about the principles of OPG. You can see the own axis movement of the film holder. Okay, let me show you. This is the own axis movement of the film holder, and forward direction of the patient, whereas the X-ray machine moves in the backward direction of the patient. Okay. You can see clearly the backward movement of the X-ray machine and the forward movement of the film holder, and you can see in that picture the own axis movement of the film holder also. Okay, the next image given that is in this the X-ray machine and the film holder moves in the 180 degree direction. There is no complete 360 degree rotation, only 180 degree movement. In this you can see that the X-ray machine moves to the back side of the patient, whereas the film holder moves to the front side of the patient, and there is the own axis movement of the film holder in its own axis. I hope you are clear with it. So next, moving on to the steps of OPG. First one, ask the patient to bite on the grooves. Okay, there will be biting grooves present in the OPG machine. You have to bite on this. You have to ask the patient to bite on this. There is close-side guides for the stabilization of the patient heads. So the guides will be stabilized. Next one, the position of the chin. Chin should be correctly positioned to get an ideal OPG. Next, the most important thing, remove any metallic earrings and nose ornaments so as to avoid the formation of ghost imaging. In the coming section, I will give you a detailed idea about what are ghost images. Next, ask the patient to stand upright. Next one, ask the patient to swallow and press the tongue against the palate and hold, and then expose the patient for radiations. I hope you are clear with the steps. Moving on to the zones of OPG. So there are mainly 6 zones of OPG. First zone is the zone of dentition. So this one is the zone of dentition. You can see the teeth present there. Second one is the zone of nose and maxillary sinus. Okay. And the third one is the mandibular body of right and left sides. So here you can see the mandibular body of right and left sides. Fourth one is the condyle of both right and left side. So here you can see the condyle of both right and left side. Fifth one, ramus and cervical spine of right and left side. Sixth one, hyoid of both right and left side. Okay, I hope you are clear with all the sounds. This is sound 1, 2, 3, 4. So for sound 4 on both sides, 5, and here also 5. Here sound 6. Okay, I hope you are clear with the sounds. Next, I have previously mentioned about the ghost imaging. Let's consider now about the ghost images. Ghost images is a blurred image formed when an object lies in between the center of rotation and the X-ray tube. Okay, this image will give you more about idea about how ghost images are formed. You can see when an object is formed between the center of rotation, that is center of rotation, and the X-ray tube, ghost images will be formed. And look, when an image is formed between when the object lies in between the center of rotation and the film, real images will be formed. And when an object is formed, when an image is formed when the object lies in the central diamond portion, okay, that is the beam passes through them twice, then what? Double images will be formed. So I hope you are clear. When the object lies in between the center of rotation and the X-ray tube, ghost images will be formed. When the object lies in between the center of rotation and the filling, real images will be formed. And when the object lies in the diamond portion, double images will be formed. Moving on to the characteristics of ghost images: opposite, blurred, magnified, and superior to the original images. Here are some examples of ghost images. You can see the metal earring or an earring in the left earlobe giving rises to a ghost images which is superior, blurred, magnified in relation to the original images in the right side, opposite side. I hope you are clear. And the above picture shows the double exposure of the hyoid bone. Moving on to the next one, that is the focal throw. So what is focal throw? Focal throw is a three-dimensional structure, curved zone, in which the structures lying within the layer will be seen while the others get blurred, magnified, and reduced in size. So what is focal throw? This is a structure in which structure should lie. That is, the structures lying within the zone will be seen and the others will get blurred, magnified, and reduced. So what is the significance? Patient's arches should be positioned in such a way to get the structures to be seen. So the position of the focal throw is identified by the three lines, that is the mid-sagittal line, canthomeatral line, and the canine line. So in this picture you can see the canine line, the mid-sagittal line, and the canthomeatral line also. So what is the significance of focal throw? So when the patient is positioned too forward, the anterior teeth will appear skinny, whereas if the patient is positioned too backward, anterior teeth will be seen as fat. So examples for this will be given below when we study the radiographic faults. So moving on to the radiographic faults, first one, if the patient positioned anterior, the anterior teeth will appear skinny. Okay, so that and if the patient is positioned to posterior, teeth appears flat. The diagram shows this, that is the patient is positioned to anterior, the anterior teeth appears skinny, whereas in the second one, the patient is positioned to posterior, the anterior teeth appears flat. So the diagram shows fat one. Sorry for the error, I have misplaced the two same diagram as for the next two also, so I will draw and give you an idea. So if the head tipped downward, exaggerated smile can be seen. So exaggerated smile will be like exaggerated smile will be like this. That is, the teeth will be tipped forward, giving an exaggerated smile. And if the head is tipped upward, reverse smile will be seen. That is the like this. The teeth will be, the anterior maxillary teeth will be seen. Okay. If lead apron is where radiopic area can be seen, because as we all know, lead will give protection from the radiation and a radiographic area can be seen. And due to the static electricity, tree branch appearance can be seen in the radiograph, which we will study in the next coming sections, and the failure to remove any appliance, as we all know, will give to the ghost images. So moving on to the advantages and disadvantages of OPG. Advantage: it's simple, can be useful in trismus and gagging problems as there is no much opening of the mouth. Then low dose of radiation helps in object localization. It is a technique for finding the position of incised tumors or like that. Mass screening, because it gives because it shows the maxillary, mandibular and their supporting structures all together, can be used for patient education. So disadvantages: it is a 2D structure of a 3-dimensional area, so can produce errors. So next one is the focal through, that is the area outside the focal through will be poorly visible. And moving on to the next one, the machine cost will be high. Overlapping of images can be seen in OPG. As this is a 2D structure of a 3D image, distortion and magnification can occur. And in this, the anterior teeth is poorly registered due to the presence of spine. So this leads to an end to the topic OPG. I hope you have enjoyed and learned my session. Please do like, share and subscribe. Thank you.